Welcome to another edition of the Business and Personal Podcast, where we bring you closer to the people that you do business with. And today we have Jomana Shayota. She is the owner of Dental House and Aesthetics of Franklin, and I feel like I have a little bit of a connection with her because we were both crazy enough to open up businesses in the middle of the pandemic last year. But hey, we're still here, we're still alive and kicking. So, Jomana, thanks for joining us today.
Of course. Thank you. I'm excited. Thanks for having me.
So, tell me about what that was like starting last fall when we were in the middle of a pandemic. Why in the world would you decide to do that?
um, it was interesting, right? To say the least. So I'd been looking for my own office for about under a year at that point. I knew that I wanted to be an owner. I knew that there was a certain setting that I wanted to have to provide for my patients. And it was kind of just the right place, right time, maybe not right time, but it was exactly what I had been looking for. And I knew that there was never necessarily going to be a perfect time. If it wasn't the pandemic, there was always some sort of obstacles, anyways. And because everything else seemed to have lined up and it felt right, I loved the location. I loved the office that I'm in now. And I took the leap. So, yes, it was extremely risky. I've been a dentist for 4 years. So I've known that I've mastered the clinical side of things, but I knew that the business side of it would be a learning curve for me. And it was. The pandemic had a huge influence on that because of overhead. So ordering things like that, that I've known everybody has been telling me, Jomana, masks are so hard to get. Masks are expensive, gloves are expensive. I knew all things going into it, but it's a little different when you're actually placing those orders. So a lot of things were hectic at that time in the beginning, but honestly, like we were just saying, it gets better and better each month. I've loved it. I'm really enjoying it. And I'm so happy I did it. Even if it was in the pandemic, I have no regrets about it. And also, I don't know if I told you this before, if it wasn't for the pandemic, I probably wouldn't have found this office. So I'll always be thankful for that. I don't think that it would have been up for grabs at the time. At least the location wouldn't have been available if it wasn't for the pandemic. So it all works out.
So you're in downtown Franklin there, and so did you take over an existing office, or are you just completely starting from scratch?
I'm starting from scratch. So the office itself, the suite was built out for a dental office already. So I have 5 chairs. I have the chairs. I have the X-ray units. That was already there. But the practice itself relocated. So when I say practice, I mean the patients relocated to a different area completely. So I took over the space, but from the practice perspective, I started from zero. So again, when we talk about crazy decisions,
So when you graduated from the University of Michigan Dental School, did you plan on at some point that this is where you're going to be at? Did it happen maybe faster than you thought it would, or was it about right when you hoped it would?
um, I think actually in the grand scheme of things, a little faster. I think I had always told myself maybe around the 5 year mark, I would want to own. And I started actually thinking about it more at around 3 years. I just felt very comfortable in my clinical skills. I felt like I wasn't um, nervous of things from that aspect. I had learned a lot about what I wanted to, so that then I knew that I could devote myself to learning on the business side of it once I took that leap in that regard. But yeah, a little faster. I will say the process itself took a little longer, though. Looking and finding the right office, that was longer, but in the grand timeline of things, it happened a little sooner. But I did always know that I wanted to own.
And you would think when you're starting like this from scratch that you're going to want to jam as many patients as you can in each day, but you take a totally different approach. You want to spend at least 90 minutes with each patient, at least on the first time, to because composition of everybody's mouth is different. So you really need to get to know each individual person. So talk about that aspect of your business.
Yeah. So your first appointment with us, as you said, it's about an hour and a half. So we block out a good amount of time that includes the x-rays, a full comprehensive exam, and a cleaning. And this is a really specific approach I take. I really like getting to know my patients. I like making my patients feel comfortable and I also take a lot of time educating my patients. When I tell somebody that they have a cavity, I want them to actually understand what it is I'm looking at, especially for people who, they're like, I don't feel anything, I don't see anything. A lot of my patients can attest to the fact that I turn you around and show you your x-rays and I tell you exactly what tooth structure and what parts I'm looking at. So I like to be able to not feel rushed, nor my patient feel like I am rushed. We create a very comfortable setting at the office. When you walk in, I want patients to know and see kind of the vibe that we're setting there. I think that our waiting room even doesn't have like a super medicinal feel, which is what I was going for. It's just really comforting. And same with when you're actually in the chair. We strive to, from when you walk in to check out, just create the comfort, always give time for questions for our patients and just understanding, honestly.
And you have a new website now, and people can go on there and kind of see everything that you do have to offer. We don't have time to kind of cover everything here today.
Right.
But one of the topics that you wanted to touch on was veneers. So talk about what you have to offer with that.
Yeah, so I do a lot of cosmetic dentistry. So the name is Dental House and Aesthetics, and that's aesthetics parts kind of come into play in those things. Um, so veneers are a very good tool for people who aren't necessarily an Invisalign case and the patient that just walk in and say, I really want that Hollywood smile, right? I really want a drastic change in my smile. And I know a lot of people offer veneers, but the biggest thing that I emphasize to my patients is I really take my time with this process. It's not just, we shape you for the veneers, you come back and you receive them and we're done. I always tell people you're a life patient once I put a big set of veneers in your teeth, especially if it's multiple. I will always be the one you come back to for any issues with this. So it's honestly so much fun. Patients are so grateful for the results that they get, and it's life changing. And there's a lot that you can do that people don't realize. So, again, I just like to educate my patients. It's not as aggressive as a lot of people believe. And you can get a beautiful result if you're not necessarily a candidate for braces or Invisalign.
Speaking of Invisalign, I went through it myself and I was apprehensive for a while. I go to a lot of business meetings and I was worried that it would affect my speech. I didn't want to have that in my mouth all day long. I didn't want to have to deal with it when I went out to eat, taking them out, all these different things. Year and a half, 2 years later, now that I've been through it, I'm so happy that I did it, and all my fears were really unfounded. Um, Talk about some of the successes you've seen with Invisalign and who is a good candidate for it.
Yeah. So many successes that I was telling you about earlier, even just minor tooth movements have made the biggest difference in my patients and just their confidence, which is a huge thing that I enjoy with Invisalign. It makes a huge change in how they feel. Many patients that come to me and say, I hate my smile, I never smile in pictures. And how, let's say 6 months later, especially if they're a quick case, they can't stop smiling. So it's so rewarding. And as you said, it's actually really easy. It's not noticeable once you start to do it. So I tell patients that all the time. The time flies by before you know it, even if it does end up taking a year. Um, in regards to who's a good candidate, over the years, the technology has honestly become very advanced that there's so much you can do with Invisalign. It doesn't have to be just those minor cases that it was, 15, 20 years ago when Invisalign was first created. They're technologically so advanced. I do a lot of minor crowding and, just over bites, crowding and the top teeth, things like that. I do have an in-house orthodontist who does only Invisalign and braces. So he's an expert from these things and braces from obviously a young age, if there is cases where that's the type of treatment that you need instead.
And I have to laugh when I see these commercials. Oh, get Invisalign in the mail. Just let's do a capture whatever your bite looks like, and we'll send these to you in the mail. And I had a friend that did that while I was getting my Invisalign. I'm like, spend the money to have a
Yeah.
professional do it. It is totally worth it.
Yeah.
A year later, he
It's
had to go to a professional because the mail thing didn't work out very well. So talk about
yeah.
how in depth the process is to prepare someone's for the proper fit for their Invisalign that you would do versus doing it in the mail.
Yeah. The biggest thing is people don't realize is we don't just put Invisalign on your teeth without proper clearance. So we have x-rays that we monitor first. We check for bone loss, which is one of the biggest problems that we're seeing with these DIY aligners. People who have bone loss are doing them and then their teeth are becoming extremely loose or mobile, and no one is monitoring that. So the biggest thing is having a dental professional actually control and monitor these movements. So when we're designing that smile, did you have buttons on your teeth? So when I say buttons, we have attachments placed on your teeth. Those are meant for controlled movement. Those controlled movements are intentional. And you can't do those with DIY aligners either. It's just force and flare on the teeth. So disease control is huge prior to beginning a process like this. And again, you can't do that with just sending an impression through the mail. We take impressions before you start. Of course, we actually have a scanner at my office, so we're not doing impressions, but typically Invisalign is that way, but we don't do the molds at all, the gooey things at our practice. We just have a digital scanner. So after you're scanned, I sit and go through your treatment plan. But after that, I'm seeing you after every 8 trays or so. So pretty much every 8 weeks at least. So I'm monitoring the movement. So if something is going wrong along the way, we don't let a year go by before we do something about it. And then you have to start from scratch. We're checking things as you go. So we spend a lot of time with Invisalign patients, regardless, at least to see and make sure that things are going as planned. It's not necessarily a long appointment when you come in, but it's enough that you have a professional checking your teeth and checking that everything is going right. And then again, like you said at the end, actually properly educating on the extensive use of a retainer, the importance of a retainer, and just having a long-term provider to go to and not just a website that you want to get some response back from.
Yeah, the interesting
But
thing about going cheap, it always costs you more in the long run, doesn't it?
yeah, and that's not the first case I've heard. We actually, I want to say like a year and a half ago, Invisalign as a brand was even offering discounts for people who had just completed DIY liners and didn't get the result, just as like a look, just as a motivation, just do it. It's worth it. Just do it and do it the right way. That's the thing. And that's what I honestly push in my office is I prefer to do things the right way. It may take longer here than if you go to the dentist across the street, but it's worth it from all aspects, whether it's the veneers, whether it's the fillings, really all aspects of it, it's worth it to take your time.
Absolutely. Another aspect of your business I want to talk about here today is the TMJ work that you do. I see a lot more of this promoted. It's becoming more and more popular. So just to educate our listeners, what does TMJ stand for? What is it exactly? And what can you do to help people out that are suffering from it? Maybe they don't even know that they're suffering.
Yeah, so the TMJ is your temporal mandibular joint, kind of part of essentially coming off of the mandible, so your lower jaw. So beside your ears, if people have pain there, down to the jaw area. So TMJ pain is, as you said, very common. So TMD is what we call it, temporomandibular disease. And so I have a lot of people that message me saying, I have horrible pain in my jaw. What can we do about it? So I will always do a very thorough oral facial evaluation. So I evaluate the muscles of the jaw leading up to the joint itself, and then the muscles of the head and neck to first diagnose where the pain is coming from. Is it just the joint? Do you have a click? Which for some people will know exactly what I mean when I say, is there a click? And is that click painful? And then we kind of go from there. So if people need a bite splint, I will start from that. If people have very significant muscular pain, especially like if they say I wake up in the morning and my jaw feels extremely tight, then evaluate, are you a good candidate for Botox into the masseters? So the masseters are two of the muscles there kind of connected to the TMJ area. So I do treat the masseters often, and I've seen great relief for my patients. And again, people with severe pain can attest to this. It's debilitating. And when you can't actually get any resolution, it does take a toll. And a lot of people have headaches as a result of it. So I really like doing a thorough eval on those patients and trying to approach their pain from that regard. The other thing that I was talking about earlier is some, not all, but some of these cases can be spotted from a young age. And a lot of more recent science has been educating everybody on the fact that these are things to look out for from in kids. So kids that grind their teeth, that's one of the biggest things for people who know that they have TMJ pain is they say, I know I'm grinding my teeth, which is when we'll give you a night guard. But I see signs of grinding or wear on my kids all the time, our kid patients. And then I have a really long talk with the parents about an airway evaluation. So this is something where if it's caught from a young age, it makes such a drastic difference before they get older. These are the adults that we see that say, I can't do anything about my jaw pain. If it was spotted when they were younger, if we knew more about this when they were younger, it makes a big difference to have the airway evaluated, to have a CT of the airway, to evaluate for tonsillectomies or having the tonsils removed. Even if those kids start braces, specifically manipulating the jaw as it's growing into a position where you would be less likely to be grinding and less likely to have airway problems as an adult. Um, I like it a lot. I've had a lot of parents that say to me, thank you for the ENT evaluation, because that's what I'll end up seeing them for an airway eval. And the ENT will tell them, I'm so glad she sent you. This is something that it's great that we spotted early. So more and more people are kind of knowing about it, but it's part of what I do on all of my evaluations for my pediatric patients as well as adults.
So great information and very treatable. So, anybody that's suffering from headaches that you can't seem to get over or jaw pain or whatever, just get an evaluation. There could be some help for you. So one last thing that I kind of wanted to touch on too, we talked about the straightening of teeth with Invisalign. We've talked about dealing with pain here, but also whitening of teeth. Also, always been a very popular thing. What do you have to offer at your practice for teeth whitening?
Yeah. So we have two options for the most part. One is our in-office Zoom whitening. So Zoom is where you come in one shade, you stay for about 2 hours, and you leave whiter automatically. I will say that a lot of people's instant reaction is, I've done Zoom before and it's so painful. And then I ask them, well, when did you do it? And it's usually at least 5 to 10 years ago, when it was a lot more sensitive. And now there's so many steps that we take prior to the appointment that has made a drastic difference in post-op sensitivity or sensitivity during the procedure. And in the recent years, it's really made a huge difference. So we place a desensitizer on the teeth during the procedure. We have you use a sensitive toothpaste before and after the procedure for about 2 weeks before and 2 weeks after. And we send you home with a desensitizer as well. And with our Zoom, we also give you a tube of whitening that goes into your custom gels or custom trays that we'll make for you. And that gel can be used, let's say like 8 months, a year down the line when you feel like you just want to touch up. So that's one option. And that's a good option for people that just say, I know I want to do it at home. I just want you to do it. I want to come in and just leave whiter and you do the work for me. We also have in-office whitening kits that you can take home that we sell. So those get you the same level of whitening. It's just over the span of 2 to 3 weeks instead of 2 hours. So that requires you to do it at home instead. Some people say, that's fine, I'll just do it, especially now with working from home. It makes it a lot easier, honestly, to just wear the trays and have your whitening gel in. So they're both really good options. For the home kits, we actually have a day white and a night white. So we have one that you could just wear through the night. It inactivates itself after about 4 hours. That gel's inactive, so it won't create sensitivity either. And with all of them, the home kits, I should say, I offer different percentages. So if somebody tells me that they are sensitive typically to cold water, anything like that, I'll give you a more mild one. It still gets you white, just being a little bit more comforting to your teeth. And we also people have custom trays already, whitening trays already. We sell individual tubes of gel that you can just take home as well. But we also have the kit.
Very good.
But
Well,
people love Zoom right now. We're going into summer. Everyone wants to be brighter. It's such a good confidence booster, honestly. Events are picking up. What I know personally, I have a bunch of weddings to attend in the next like 2 months, and it's such a good procedure before an event like that.
and as I said, people can go out on your website to see everything else you do. You have many other things you do than there's just the things that we talked about here. What is your website address so people can learn more about you?
Our website is dentalhousesmiles.com. So as you said, you can learn a little about me on the website, a little about what I provide. You can see a lot of before and afters for the procedures that I just talked about. We have veneer cases on there, Zoom cases. Invisalign cases are on there. And you can also get a glimpse of just our vibe at the office. You can see our waiting room, our patients. I love taking photos with my patients. We always ask you for social media release. I put a lot on my personal Instagram about our office as well, and our business Instagram. So my personal one is just my first and last name, Jomana Shayota, where you'll see a lot of just our day to day at the office. Honestly, we have fun. We enjoy our time with our patients. And the business Instagram is DH and Aesthetics. And that's where you'll get a lot of glimpse of us in addition to our website.
And you're still accepting new patients. It sounds like you accept patients of all ages. You work with kids as well. How quickly can someone get in with an appointment for you?
I do. I mean, currently our turnaround is I would say at least 2 weeks at most. We can usually work around it. We have night hours on Fridays, and we're open most Saturdays as well. So just call. We are accepting new patients, like you said, big and small.
And make sure you block out 90 minutes because you're not getting in and out. Dr. Jomana is going to want to make sure you have a thorough evaluation.
That's right.
So again, thanks for coming on. Congratulations on building a business at the most challenging time. I think the toughest is behind, and you're just going to keep moving forward here. So best of luck to you moving forward.
Thank you so much. I appreciate it. Best of luck to you as well.
All right, thank you.